Bismillahirrahmanirrahim, dear students. I hope you all are fine and in the best conditions of your health. So in today's lecture for the course of medicinal chemistry, we shall study about drug formulation. The key concepts which we shall discuss in this lecture will be the mode of drug administration, what are excipients. Also, we shall study about what are the objectives for drug formulation and what are the various considerations which have to be considered during drug formulation. So drug is any substance that can have any positive or negative effect on your body, right? So anything, any chemical, anything that has some effect on your body, we say that that's a drug, whether the effect is positive or whether the effect is negative, right? So far we have discussed how we discover a drug, right? So the process starts with the hit, then we refine the hit to form a lead, and this lead can be further refined from the most active form of pharmacophore, which we call as the drug, right? So drugs are never taken as such, right? So if you have refined a drug, right, so that gives the best biological activity, right? But then you have to give this drug to a patient. You do not give that pure compound to the patient, right? We have to make that drug in some more acceptable form, in more usable form, right? So this formulated form of a drug, formulated means that we have to convert a drug that can actually be given to a patient, right? And that drug should be acceptable for the patient. It should be easily administered inside the body, right? So this modified form of the drug, in which we add certain things so that the drug become more acceptable and easy to administer into the patient. So this drug is called formulated drug, right? And this formulated form of a drug is called a medicine, right? So when you say that I'm going to take medicine, actually that's formulated form of a drug, right? So here in this lecture we shall study that how we carry out the formulation of drugs. So in the previous lectures we have studied about pre-formulation, right? Pre-formulation, the studies that are carried out before we form a drug, we formulate a drug, because before you mix the drug with certain things else, you must know that which things should be mixed, right? So in this lecture we shall continue about how we can formulate a drug and various considerations which have to be considered while you formulate a drug. So before moving towards drug formulation, it's very important for you to know that what are the various modes of drug administration, right? So when you are carrying out the drug formulation, it is very important for you to know that how you are going to administer that drug inside your body. So there are basically two means of drug administration, right? Number one is the systemic administration. Number two is local administration. So systemic administration is the route of administration in which the medication, that is the drug you are taking, or the nutrition, that's the food you are taking, or any other substance, right? So if anything that enters into your circulatory system, right? So in such mode of administration is called systemic administration, right? Whether the thing you are taking in is a medicine, that's the nutrition, that's in the form of food or anything else. So if anything gets inside your circulatory system, then this mode of administration is called systemic administration. And it's very important for you to know that whenever a drug is administered in systemic manner, in that way the drug will affect your entire body, because the circulatory system, that means the blood or the lymph system, that is moving throughout your body. So when your drug enters into your circulatory system, it means the drug will circulate throughout your body. So in this way the drug will affect your body, entire body. Second way of administration is local administration. Local administration means that the drug will be administered in a very specific area. For example, if you have some sprain in your ankle, so the balm or the cream that you apply, that affects only at the area of your ankle, right? So when the effect of a drug is limited to a certain area, such mode of administration of drug is called local drug administration. Right? So majority of the times the drugs that are administered are administered by systemic manner. Right? So when you're considering the systemic administration, there are different ways you can carry out the systemic administration. Right? Each of these have their own benefits, and each of these have their own limitation. So number one method is the enteral administration. So if you give a drug to a patient and the drug is absorbed through the GI tract, right? GI stands for gastrointestinal tract, right? So whenever you give a patient a drug and the drug is absorbed through the gastrointestinal system, this mode of drug administration is called enteral administration. Number two is the parenteral administration. Parenteral administration involves use of injection, infusion, or implantation. So that's an invasive method, right? Again, in this case, the drug is directly entering into your blood system, right? So the parenteral mode of administration is very fast, because in this way you are entering your drug, you're administering your drug directly into the bloodstream. Next is topical administration. So topical administration refers to a medicine that's applied to body surface. For example, it's normally applied on the skin or on the mucosal membrane. For example, if you apply some cream or balm inside your nose, right? So you know that nose has mucosal membrane. So in that case, this is called topical administration. Similarly, if you apply any balm or cream inside your palate, inside your mouth, then again that's topical administration. The topical administrations normally involve use of creams, foams, gels, lotions, or ointments, right? So again, when you apply such medications on your skin or on your mucosal membrane, in that case the drug will enter into your bloodstream, right? So in any way, whether you are taking a drug through mouth, or you are taking a drug through injection, or you are taking a drug through the topical administration, so in all of these cases the drug is actually entering your blood system. So which is your preferred use of drug administration? Whether you want to use a drug in the form of topical application, or you want a drug to be injected, or you want a drug to be taken orally, right? That depends on the situation of drug as well as patient, right? For example, if a drug is very lipophilic, then it's very suitable for it to be applied on skin, because the skin is also lipophilic, right? That's non-polar, so it's very easy for the drug to get penetrated through the skin. But when you take such a drug through mouth, because that's the more lipophilic and the medium of mouth is watery, in that case the drug will not be compatible with your mouth, right? So also the mode of drug administration depends on the situation of the patient as well, right? So in certain cases, certain medicine will induce vomiting when taken orally. In that case you can go for parenteral administration or topical administration, etc. Right? So let's see the modes of drug administration in a bit more detail. Number one is oral solid. Oral means the drugs that are taken through mouth, and solid means, now we are considering about the medicines or the drugs that are taken orally, but they have to be swallowed. Right? So very oldest method, most common method. So normally you take the capsules or you take the tablets. So these are belonging to this category, right? So in this method, when you are taking a drug that is absorbed orally, then that's swallowed orally, in that case the drug has to pass through the intestine. The drug has to pass through your gastrointestinal system, GIT tract, and most of the drugs are absorbed in your small intestine. So such drugs act well when they are taken with an empty stomach, right? So when you are taking a drug and your stomach is full, in that case the problem is that drug is not absorbed, and the absorption of drug is very delayed. So you might have often heard the doctors that you have to take this medicine with empty stomach. So what does empty stomach mean? So when your stomach is empty, then in that case the absorption is very rapid. But when you have eaten something and you take the medicine, in that case the absorption of medicine is delayed, right? That's why you have to take the drugs normally with empty stomach, right? So whenever you take a drug orally that has to be swallowed, it has to undergo first pass metabolism by the liver. So you can imagine that because of this first pass metabolism, the drug will be extensively metabolized before you reaching your target receptors, and the amount of drugs that will be available for binding with the receptor will be highly reduced. Right? This is the disadvantage of orally swallowed drug, because they enter through the first pass metabolism in the liver. So as a result, the amount of drug that is actually required to give you the biological response, that is reduced by the metabolism in the liver. Right, so far this is the safest, convenient, non-invasive, painless method of medication. So you don't need to care for the sterile injections. It's also cheaper, right? So you can take the dosage form in the form of solid or liquid as well, right? But the disadvantage or the limitation of this method is the first pass metabolism. The second mode of drug administration is oral sublingual. Oral means it has to be taken through mouth, and sublingual means under tongue, right? So when you are taking a tablet or a pellet, right, containing drug, and you have to place it under your tongue, or you have to crush the drug with your teeth and spread over your mucosal membrane, right? So in this case, this is the fast systemic absorption, because when you take the drug and you place the drug under your tongue, in that case the surface under the tongue is highly rich in blood vessels, right? So there are a large amount of capillaries. So when you place the medicine under your tongue, the medicine gets absorbed in the watery medium under the tongue, and this medicine is directly entering into your blood system. Similarly, when you crush the drug with your teeth and spread it all over the inside of your buccal cavity, in that case again what's happening, that you are actually allowing the drug to be absorbed directly into the bloodstream. So this is a fast absorption method, right? Again, that will bypass gastrointestinal tract, avoid the absorption, and avoids first pass metabolism in the liver, right? So since that's not going to the liver, it's directly entering your bloodstream, so that's why the problem of first pass metabolism will be avoided, right? Also, it is very useful for those patients who tend to vomit when they tend to swallow medicine, right? So when you place medicine under your tongue, then it does not pass through your gastrointestinal system, so the process of vomiting is avoided, right? So this oral sublingual method is effective when you have patient that tends to vomit out the medicine. Also, it is very effective when you want to avoid the first pass metabolism in the liver, right? Because that medicine does not undergoes and the processes in the liver, because it's directly entering into your bloodstream, right? Next method is rectal method. So here the drugs are directly absorbed through the rectum. It's also a method that avoids first pass metabolism by the liver. However, this is some partial method, because half of the drug, or almost half of the drug, still enters into the liver and is metabolized inside the liver, right? So it's partially absorbed, it partially avoids the first pass metabolism. It's very effective for those who tend to vomit out the medicine, right? As a result, the amount of medicine is lost, right? So also there are certain drugs that are very, very unpleasant and very irritant, so they can be put into the rectum as suppositories, right? So when you have a drug that is very unpleasant and very irritant and you cannot take it through mouth, then you can take it, or you can administer them as suppositories in the rectum. Then we have epithelial mode of administration, right? In this way, the epithelium, you know, that top surface of your skin. So in this way, the drugs are absorbed directly through the skin. This route is very useful for those who are very, very likely to vomit, right? For example, nicotine. So nicotine is very easily vomited out, right? So people don't have the tolerance to nicotine, when nicotine is given in the concentrated form. So what we do is that we apply the nicotine in the form of patch, right? So also, if the drugs are highly lipid soluble, if the drugs are highly lipophilic, that they can be applied over the skin, right? So in this way, the drug is slowly and prolonged absorbed through the skin, right? And that's in this case, since the drug is entering directly into your bloodstream, so the first pass metabolism is avoided. So we say the drug bypasses the liver, right? So if you say that the first pass metabolism is avoided, it's the same as saying that the drug bypasses the liver, right? So drugs normally that are applied in this way, they include ointments, right, or in the form of creams, and such drugs are applied in certain specific area, right? Next we have inhalation, right? So if you have drugs in the form of volatile oil or gases, then they can be inhaled in the form of inhaler, such as general anesthetics, amyl nitrile, right? So again, these drugs directly enter the bloodstream through the lung. Again, there will be no absorption, and the first pass metabolism will not occur, right? This route is dangerous because it's very fast and very direct. So we want our drug to act in a slow and prolonged manner, but inhalation is a very rapid manner of drug administration, right? So inhalation is potentially different. It's a dangerous method, so it's normally avoided under normal conditions. Next we have parenteral route. The parenteral route means the administration by means of injection into the tissue or into the blood, right? So in that case, again, the drug is not entering your intestines, so again that will not enter into the first pass metabolism, which will be avoided. So the route can be employed in unconscious, uncooperative or vomiting patient, right? So you cannot give a drug to a patient who is unconscious, but you can give the drug in the form of parenteral route, in the form of injection or in the form of dose. The important parenteral routes are subcutaneous. So subcutaneous are the injections that are given into your skin or below your skin. Then we have intramuscular. Certain injections are directly injected into the muscles, so they are called intramuscular. Then we have intravenous, right? So the drips or injections are normally intravenous category, right? The subcutaneous or intramuscular effects, they are very quick than the oral administration, because you are injecting the drug directly into the bloodstream, and it's the fastest method. IV stands for intravenous. It's the most fast and most effective method in terms of obtaining desired concentration in blood plasma, right? So that's the fastest and most effective method. So you have seen inhalation is a very rapid method, but inhalation is a dangerous method because that's a very direct method. But very controlled and very fast method is the intravenous method. By means of intravenous method, by means of injection or by means of drips, you can maintain the desired concentration for drug for a desired period of time, and the effect is very fast. Now we go to the drug formulation. So we have seen that we can administer the drug in the form of systemic method or in the form of oral method. Also we have seen different systemic pathways by which the drugs can be administered. So in the start I told you the drugs that we are taking in the form of medicine, they are not in the form of pure chemical, right? Actually they are combination of different chemical species. So the drug is actually the active pharmaceutical species or the active pharmaceutical ingredient, right? So in addition to that, we add certain inactive substances. What are the purpose of these substances? We shall study in the later slides. But these active substances, in addition to the active pharmaceutical ingredient, they together form the medicine. So these inactive substances that act as a vehicle or act as a medium for the drug, right? So these are the medium in which the drug substance is trapped. So these are called excipient. So excipient includes the coloring agent, preservatives, fillers, etc., right? So normally the color of the medicine is because of those excipients. Similarly, the certain drugs, they have some pleasant taste. So the pleasant sweet taste is also because of excipient, right? So whereas the drug formulation is a process in which the drug and excipients are combined. So excipients are the inactive ingredients, right, which are added to the drug. So the process in which we combine together the drug and excipient to fabricate a final medicine, right? So that medicinal product will be in the form of syrup, that can be in the form of tablet, capsule, injectable, liquid, powder, etc. So this form of medicine is called the formulated form of medicine, or also we call it as dosage form, because the syrup that has certain desired concentration of the drug, right? So the drug is in certain concentration amount, and in addition to the drug we have also added some extra species into it. We have added some extra chemicals to it. So those extra chemicals which we have added to the drug, they are called the excipient. The dosage form, or the formulated form of the drug, is actually the physical form of the drug, right? So when you say that's tablet or capsule or aerosol or inhaler or injection or powder sector or whatever, so this is actually the dosage form of the drug, right? Or we say it's formulated form of the drug, right? So why we form the dosage, why we form the dosage form of a drug, or why we formulated form of a drug, is the purpose is to achieve a predictable therapeutic response, because we want our drug to act slowly. So the excipients will allow slow release of the drug. You can just imagine the drug is trapped within the excipients, right? So excipients will allow slow release of the drug from this trap. So as a result, we can just predictably achieve a certain therapeutic response from a drug in a given formulation, right? So when you take a tablet, the actual drug is in a very, very, very small amount. The rest are all of the excipients. For example, majority of the drugs that are administered inside your body, they have milligrams of drug inside, right? So the remaining components are the excipient. And the mode of administration, that's dependent on the condition of your drug and the condition of your patients. So ideally the excipients should be inactive, should be non-toxic, should not interact with other excipients, or should not interact with other ingredients. But in practice, very few excipients meet this criterion, because excipients are also chemicals. So these excipients interact with each other, and they also interact with the drug. As a result of that, we get certain toxic effects as well. So just for example, we have just summarize here are few of excipients, very common excipients, and we'll see about their side effects, you can say, right? So we have, just for magnification, I'm sorry. We have tetrazine as coloring agent, right, and that causes hypersensitivity. Then we have certain sweeteners, right, so these have also some side effects associated, right, with certain patients with phenylketonuria, right. Then we have benzylammonium chloride, that's actually used as a preservative. So you can see that excipients and their function, right, but they have the problem with bronchoconstriction, right? So although the excipients need to be inert, but the excipients are not actually inert. Then we have certain other chemicals which are antioxidants, which you can see that they cause hypersensitivity. Lactose, basically it's used as a filler, but the patients with problem of galactosemia, right, so this causes some problem of hypersensitivity, right? Similarly, sesame oil, that's an oil in the injections. Then we have other emulsifiers, etc. So they cause hypersensitivity, right? So it means that the excipients that we are using, the excipients, although theoretically they should be inert, but in actual practice these excipients are not inert, right? They have certain side effects. Very important for you to know that whenever you are considering use of certain excipient, you should know about the nature of the excipient, right? So as I mentioned earlier, that active pharmaceutical ingredient, that's your drug, that's really administered pure form, but they're always given in the dosage form. Dosage form means formulated form. That means combined with excipient, right? So it's very important for you to, whenever you are making a dosage form of a drug or whenever you formulate it from a drug, right? So it's very important for you to know the details of the excipients, which concentration of excipient you should be using. So all of this data that comes from the pre-formulation studies, right? So you have to choose the correct excipients. So the data is already available with you, and you can just by seeing the data you can just pick out which is the most suitable form of the excipient that can suit your need of the time, right? So next we have that whenever you are considering to formulate a drug, there are different important considerations when you formulate a drug. Number one, what's the nature of illness? Second, how you are going to treat the illness, right? Whether you are going to treat the illness by a local mode of administration or the systemic. So in the early slides we saw about what is the local or systemic administration. Then also the age of the patient is a very important factor in that case. So just for example, consider that if a person is persistently nauseating or vomiting, then you cannot give the drug in oral form. In that case, you can have to think about certain alternative way. You can see for inhalation, buccal, sublingual, nasal, suppository, or parenteral route. Nasal means by depositing or applying through the nose, right? So this is the problem, right? So you have to make a medicine such that it fulfills the need of everyone. So if you are going to give a medicine to a person who is vomiting, you cannot give it in the form of orally. Similarly, if a person is unconscious, you cannot give it in the form of orally or by means of inhalation. So you have to go for the parenteral route. So it's very important for you to formulate the drug to meet the needs of all sorts of patients. Similarly, a specific dosage form may be required for certain kind of drugs, right? For example, there may be some issues with chemical stability or pharmacokinetics. For example, insulin cannot be given orally because it's a protein in nature, and this protein is metabolized in the GIG tract. So that's why you have to give it directly into the bloodstream, right? So that's why in this way, when you are considering to formulate a drug, you must consider the nature of the drug, you must consider the nature of excipient, you must consider the nature of the illness and how you're going to treat the illness. Also, you have to consider the general nature and the condition of the patient you're treating, right? Also, the stability of the dosage form is a very important factor, because when you are going to formulate a medicine, when you are going to add some excipients to give it certain flavor, to give it some stability and solubility, etc., it's very important that this dosage form or that formulated form or that combined form of the drug with excipient, that should be stable. It should not be such that when you have formulated medicine, you place it outside and it readily absorbs some water from the air, right? That means the drug is not stable. So the dosage form that you are forming, the dosage form or the formulated form of a drug should be stable, right? Cost, aesthetic value means the appearance of the medicine. So, and ease of administration, they are also very important method. So cost and aesthetic value, that solely depends on the excipient you're using and the formulation process adopted. So if the ease of administration, right, and the cost, if they are in agreeable range, you can just imagine that the cost of the medicine will be lower, right? The cost of the medicine solely depends on the formulation process. So if the formulation process is very simple and involves use of inexpensive excipients, then in that case the cost of the medicine will be lower. But if you're making use of expensive excipients, expensive method of formulation, then in that case the medicine will also be expensive, right? The ease of administration or the application does not depend on formulation but also on packing. So you must consider about whether you are giving the drug in the form of a capsule, whether the capsule is hard, the capsule is soft, and what's the state of medicine, right? So it's not only just the ease of administration also depends on the packing of your drug. Right. Next, we have purpose of drug formulations. Why we are actually formulating the drug. Number one is that we want to protect our drug, that's the active pharmaceutical ingredient. Right? The active pharmaceutical ingredient is actually your drug that you have developed so far. So we do not want our drug to be destroyed by the environment. We want to protect it from the environment. Right? Second, we want to conceal or we want to hide the bitter, salty or bad taste or smell of your drug, because the drug is a pure chemical. It has some bitter taste, may have some unpleasant taste or unpleasant odor. So in order to conceal that odor, in order to conceal that taste, we formulate the drug. Right. Also, if you have the problem if your drug has a problem of insolubility, or you want to slowly release the drug inside your system, then we carry out the formulation of the drug. Right. Also, when you are making a drug for application on topical route, right? Topical route means when you are considering to apply a drug in the form of a cream or oil in the form on the surface of your skin, right? In that case, you have to make use of excipients, or you have to formulate it in the form of drug so that it can be absorbed readily through skin. Right? Also, we have to formulate the drug so that it can directly enter to the bloodstream. We can also formulate a drug so that it can be absorbed directly through your lungs in the form of inhalation. We have to protect the drug from oxygen and humidity, right? Also from the destructive environment of your gastric acid, that's the HCl. So in case you're making use of enteric coated tablets, right? In that case, enteric coated tablets, what's happened that you are taking the drug orally, that goes to your gastrointestinal system and inside your stomach. So once inside your stomach, what happens that the gastric acid, that's the HCl, that destroys your drug. So when you are making use of enteric coated tablets, so what happens, the HCl can only destroy the surface of your tablet. Right? So it's not able to destroy the active ingredient, that's your drug. Right? So in that way, when we carry out the formulation of a drug, the formulation of a drug is carried out in order to protect the drug, in order to improve the solubility, in order to make the drug effective to be absorbed through your intestine, or absorbed through your blood, or absorbed through your skin, or absorbed through your lungs. Right? So in order to know whether you have to formulate a drug as a solid form or liquid form or semi-solid form, etc., we make use of pre-formulation studies. Right? So such pre-formulation studies help us to evaluate the physical, chemical, mechanical properties of the drug, its stability, and how it can interact with other chemical ingredients, that's your excipients. Right? It's very important for you to know that how the drug is interacting with the excipient and how the excipients are interacting with each other. By knowing such interactions, we can just predict that this is the most suitable combination in which there is a minimum interaction of your drug with the excipient, and interaction between excipient and excipient is also minimized. This is all about the drug formulation. I hope that you have understood this lecture well. Thank you for your patience.